Also getting vaccines this week, Keith Grant, an advanced practice registered nurse who is in charge of infection prevention for Hartford Healthcare. He rolled up his sleeve on Monday at Hartford Hospital, becoming the first person in the hospital system to receive the COVID vaccination under the emergency use authorization. You see the moment right there. And his colleague, Dr. Melisha Cumberland, also received a shot in the arm at Hartford Hospital. She is the chief of the Department of Medicine at Wyndham Hospital. So what was it like for them, and how have they been feeling over the past few days? They are joining us now to share their experiences and answer your vaccine questions. Welcome to you both, and thank you so much for being with us.
Absolutely. Thank you for having us.
Absolutely. Thank you.
You're so welcome. We thank you. We want to get right to our viewer questions. And just so you know, we received hundreds of them. The first question from Sally, who lives in Salem, and she wants to know, is the vaccine going to burn when it's injected? Dr. Cumberland.
Sally, that was one of my fears. And no, it did not burn when I was injected. It was painless. I didn't even feel any local. Sometimes when you get the vaccine, I know, especially the hepatitis shot, sometimes it can burn a little bit. No burning at all, Sally. So be fearless.
All right. That is good to hear. Now we want a question for Mr. Grant. This is from Charles in East Hampton. He asks, at what temperature is the vaccine when it's administered? An interesting question, because we've spoken a lot about how it has to be kept at a certain temperature.
That's a good question. So yes, the vaccine has to be kept at a very, very low temperature, but when it is reconstituted and administered, it is at room temperature. So it is at room temperature when administered.
All right, so we're not going to be freezing when we get it. Thank you.
Absolutely not.
Well, you have both helped us understand what it's like to get the vaccine. We also want to talk about the very basics. Gretchen from Waterbury reached out on the Channel 3 app asking, what is the purpose of the vaccine? Does it stop the virus? Will it protect us from the virus? Dr. Cumberland, do you want to take this one?
Sure, absolutely. Gretchen, great question. The purpose of the vaccine is really to decrease the symptoms that people get when they're infected with COVID-19. Right now, there's just not enough evidence to show that it protects you from getting the virus again. We know that the vaccine is 95% effective. So we know that if that's 95%, then 5% can still get 5% of people still vaccinated can still be infected with COVID-19. So despite getting this vaccination, we encourage you to still continue social distancing, still continue masking. But the purpose, Gretchen, is to decrease the symptoms, and we just don't know yet if it's going to protect you from getting it again, if you do get it, but symptoms.
I also quickly want to ask both of you, you received your first doses this week. How are you both feeling? Have you experienced any side effects?
So
I did great with the shot. It was only at the site, little arm soreness, just like Patrick noted. I will say though, on day 2, I did start to experience some fatigue. I didn't know, I don't know if this was the mom of 5 full-time worker fatigue or if it was the vaccine. So it wasn't until I believe the next day when some of my colleagues who started to receive it did start experiencing some fatigue. So I said, okay, this must be the vaccine. But other than that, I feel great, and it didn't slow me down.
And Mr. Grant, what about you?
No, nothing so far. Slight tenderness at the actual site itself, but that is an expected side effect or adverse reaction. So.
All right, good to hear. We